This talk is about glaucoma and how it impacts your ability to drive. So we all know that being able to drive is very important. It gives you independence, enabling you to visit family and friends, getting to appointments, maintaining hobbies and activities, and more importantly, getting to the supermarket. And you don't want to be in this situation like this poor lady. We still also don't have self-driving cars, but hopefully this won't be too far away. So if you have glaucoma, does that mean you can't drive? The answer is false. The good news is that most people with glaucoma can still drive, so relax. But how does glaucoma affect your driving? Well, glaucoma affects your side vision. So this is a patient who has fairly advanced glaucoma, and what they're actually missing is quite a lot to the sides of their vision. But you're not actually aware that you're missing the sides of your vision because your brain fools you into thinking that everything's okay, and it just fills in the gaps. But it has this kind of blurry look to it. And the issue is that this all develops very slowly. So once again, you're not actually aware that anything's going wrong. So here we have a slow transition from normal vision to early glaucoma, and then gradually it becomes more advanced with worsening of that side vision over time. This is just a video to demonstrate how glaucoma might affect your driving. So this is a patient who has glaucoma that's affecting the right side of their vision. So you can see that there's this blurry patch to the right of their vision. And the issue is that objects or pedestrians, cyclists just they seem to appear out of nowhere because you're missing that side vision, like just shown there. And then this is further exacerbated when the conditions are poor, like in rain or at nighttime. So that's one of the reasons why glaucoma can have a significant impact on driving. Glaucoma can also affect your contrast abilities, so how to distinguish shapes and colors, as well as glare-related problems, and also nighttime driving can be very challenging. So overall, there is an increased risk of accidents with glaucoma. Now, most of us do need a driver's license. So what are the requirements for a driver's license? Well, there are two parts to the driver's license test. The first is visual acuity, which is a test of your central vision. And then the second is a visual field test, which is a test of your side vision. So you've all probably seen this before, and this is actually a crude way of checking both your central vision and your side vision, and is used as a screening tool. If you have a problem with that test, then a formal assessment is usually required, which is through your optometrist or an eye specialist. So visual acuity testing is when you read on the chart, the Snellen chart here. So the top letter, if you can only see this, that's very poor vision. But if you can read all the way down to the bottom, that's normal vision. And the driving standard's kind of just below midway, which is 6/12. And that's with both eyes open and with your glasses on if you wear glasses. The good news is that glaucoma doesn't tend to affect side vision unless it's very advanced. But what can affect your central vision? So if you're short or long-sighted, this can have an impact. So it's important to make sure that your glasses are up to date. If you've got cataracts or other eye diseases that can be fixed, it's important to look into this. And then there are other conditions that unfortunately can't be improved upon, like macular degeneration. And the other part of the driving assessment is your side vision test, the visual field test. and it must be at least 140 degrees, which is shown here. So if it's less than that, unfortunately, you won't meet the criteria for driving. And the best way to test that is with a specialized visual field test, which I'm sure most of you are familiar with. And it gives us a printout like this. So 140 degrees is shown in this diagram here. So you've got to be able to see the flashing spots within this entire range to pass the driver's license. If you just miss the odd spot, it's usually still okay. This test is a little bit easier than the usual visual field test because it's with both eyes together and the lights are also brighter. So most people will meet these requirements, but if you don't, it's not the end of the road. There's still hope for you. So you could go see another eye doctor, but that's not the right answer. The doctor's not the bad guy in the situation. We do have a legal obligation to report to the transport agency if we're concerned about your driving ability and you're still driving. However, there is an option of seeing an occupational therapist who's an expert in driving assessments. And this can be requested by your eye doctor or the New Zealand Transport Agency. And these are available throughout Auckland and the country. This assessment has two components. The first is an off-road assessment, however, not this type of off-road assessment. It's one that's done in the office room. And this is it looks at a range of things. Firstly, vision screening, your coordination and judgment, your memory, decision-making times, and your knowledge of road rules. And then the second is an actual on-road assessment, and it tests your driving in a range of situations, driving through intersections, as well as your ability to park and maneuver a vehicle. And then they'll write a report to your eye doctor or the New Zealand Transport Agency with a recommendation. And either they'll say that you're not safe to drive or that you can continue to drive without any problems. But the most common outcome I find is being able to drive, but with certain limitations, such as during the daytime and just in areas that you're most familiar with. If you are advised that you can't drive, you can appeal this decision through the court system as well. So if you have glaucoma and you are driving, what are some of the things that you can do today that will make you safer on the road? So firstly, you can scan your visual environment better. So moving your head and eyes from side to side much more than what someone without glaucoma would need to do. Be alert for other vehicles, cyclists, pedestrians, and children. Drive more slowly, as this gives you more time to scan your environment and react to sudden events. And glance often at your rear view and side mirrors. Make sure your windscreen is clean and headlights are all working properly. Make sure your glasses are clean and up to date, and check if they've got an anti-glare coating or get sunglasses for bright days. And drive only in your comfort zone, so familiar areas, not in bad weather or at night. And finally, make sure you take your eye drops and be compliant with treatment so that the glaucoma doesn't get any worse. If you definitely can't drive, it's not the end of the world. There are lots of services available to help you, such as volunteer drivers, public transport, taxis, Uber, mobility scooters, and of course, walking to nearby areas. So that's all I had to say today. But if you do have any questions about glaucoma and driving, please feel free to email me at this address here. Thank you very much for your attention.